Hello everyone, this is Mr. Harper, and we are going to continue our discussion of the integumentary system. Specifically, we are going to concentrate on the skin, and we're going to finish this unit. There's two more ed puzzles, this one and the next one, talking about disorders of the skin. And so our objectives distinguish between infectious skin diseases and allergies, and also to explain the causes of acne. Now, Mr. Short will finish up and talk about cancers. But that's going to be another ed puzzle. So let's talk about homeostatic imbalances of the skin. So homeostasis says things in your body are maintained in a certain set pattern. Well, when those patterns or those set points are disrupted, it can cause diseases. It can be, or let me rephrase that, diseases can cause disruptions. And so that's what we want to talk about. So first we want to talk about really quickly is athlete's foot. It's caused by a fungal infection, very common on the foot or other moist, warm areas of the body. If you've heard of jock itch, it's caused by the exact same fungus. It's the same problem, just in another area of the body. That would be in the crotch area, because those areas are typically warm because they're covered, and moist areas of the body. And so you have a fungus that can cause itching, cracking, pain. Here's a picture of athlete's foot. And it can be pretty easily treated with antifungal medication, a cream. Second kind of thing, cold sores. Here's someone that has very bad cold sores all around their mouth, on their face, and on their lips. Cold sores can be a problem inside the mouth, can also be, in this case, outside. It's actually caused by a virus. And another name for cold sores is a fever blister. And you've probably all have had those. And it's caused by a virus that is a herpes virus. It's not the same virus, not the exact same viruses that causes a genital herpes, but it is still a herpes virus that is the problem. Third problem called impetigo. It's caused by a bacterial infection. Here's a very severe case. Pink fluid-filled lesions around the mouth and the nose. Is going to be on pink to red and very, very painful looking. Once again, that's a bacterial cause. Ringworm. Ringworm is not caused by a worm. It is caused by a fungus, but it is a ring mark frequently on the lower part of the anatomy. The foot is oftentimes a place. Moist areas with frequent wetness, and can be caused by minor injuries to the skin where this fungus can get into your body. And here is some typical ringworm. Can you see? It could be on the hand here too. Here's on the, looks like it's the crook of the knee, back here on the back of the knee. And you can see that it causes this ring appearance, and that's why it's called ringworm. Another problem that can occur, acne. We probably all had experience with this. Acne is caused by overproduction of sebum. Sebum, remember, is the oil that is released by sebaceous glands, and every single hair follicle in your body has a sebaceous gland with it. That oil is secreted into that follicle, into that hair follicle, and if that follicle gets plugged up, then as more and more oil is made, it starts to swell because oil can't get out. And those pores can be clogged by dead skin cells. Those skin cells are dying all the time. Can be clogged by dirt, debris, makeup. And if they become inflamed, swollen, they form these red bumps. If you get a bacterial infection in there also, then there's even more swelling, even more inflammation. And then white blood cells come to kill the bacteria die, some of the white blood cells die, and it forms pus, and then you get that whitehead on the pimple. So that's actually caused by an infection that is a secondary to the original inflammation of the acne that was just caused by a blockage in the pore that couldn't let that oil out. Acne has nothing to do with your sweat glands and the pores from that. It's all from the sebaceous glands, the oil glands. So one of the most important things to do to prevent acne is to wash your face. Wash your face frequently to cleanse those pores to open them up. And here's some acne. Acne is frequently a facial thing, but it can be all over your body. Here's someone that has some pretty severe acne on their back. And for most people, acne is just something you need to get some over-the-counter medication, to put on some creams, some soaps. But for some people, it's very severe, and they end up having to go to a dermatologist to have special medications to help to cure that problem. So here's your normal hair follicle with the sebaceous gland here on each side. The gland, the pores open, the oil gets secreted, and it goes out onto the skin along with the hair. But if this pore gets blocked, as more and more oil is made, the oil gets trapped here, forming that bump. And then if there is a bacteria in there, then it really causes even more swelling. The white blood cells come in, even more swelling, and forms that whitehead on the top of the pus. It's all happening in the hair follicle. Some other causes of acne: genetics. You're just born with a predisposition to get it. Hormone changes for females in the menstrual cycle. Stress can cause acne. Greasy, oily cosmetic products or hair products. Drugs, steroids that maybe you would take for some kind of inflammation. High levels of humidity and sweating can sometimes lead to those pores being clogged. The sweat's not causing it directly, but it could lead to the pores for the sebaceous glands being clogged. Some people say diets high in refined sugars or milk may play a factor. That is very unknown, not fully understood, but that's what some things point toward perhaps being a problem. So that's acne. Now, we've talked about the problems that are infections from like a fungus or a bacteria or a virus. Now, let's turn our attention to allergies. Allergies are not caused by some kind of a foreign invader into your body that's causing the problem. An allergy, such as hives, red, itchy welts on your skin like this, can pop up very, very quickly, are an allergic reaction of your body to something, such as an insect bite or pollens, a food, medicines, animal dander. Some people are allergic to cats, or some people are allergic to bee stings. My daughter's allergic to nuts. It can cause hives. Hives can also be caused by stress or cold or hot or illnesses. And your body releases this chemical called a histamine, which causes your blood vessels to widen, and that can lead to inflammation, to swelling. Hives can pop up very quick. Fluid in the vessels ooze into surrounding tissues and cause even more swelling, and that swelling is evident in the skin. Hives, like I said, can come up very quick and can go back down very quick, or there are medications that decrease the swelling. Best thing to do is to avoid, if it's an allergic reaction, to avoid that substance if possible. Another allergy, eczema. This is chronic skin disorder, which means it's a long-term thing. It doesn't just happen overnight. Scaly, ishy rashes on the skin, dry, flaking skin that's blistered, it's red, it's swollen, it itches, it burns. It can be an allergic reaction to chemicals. It could be a fabric that you're wearing, that's something in that. Heat can cause it, dryness can cause it, and it causes these red blotches. And medication can help with this, but this is frequently a long time battle that people, they don't like totally cure it. They just learn with medications and avoiding certain things how to manage the disorder, because it's an allergy that can pop up over and over again. So that's the end of this. Next cancer that Mr. Short will talk about. But remember, we're talking about here homeostatic imbalances or disorders. Things that are disorders that are caused by bacteria, by fungus, by viruses, or by allergies. We just talked about a few here. There are many, many, many more. See you next time.